Health officials say COVID is surging. It's the biggest summer spike since 2022, so should we be concerned? There's a growing number of coronavirus cases in the U.S. In Los Angeles alone, it shot up from 413 a day to 452. The Centers for Disease Control and Prevention says the District of Columbia, along with 26 other states, are seeing substantial increases in COVID-related emergency room visits. So in California, COVID cases are on the rise, the most that it has been in 2 years. Do you think people should be concerned, and are you hearing that people are concerned?
No and yes. No, we should not be concerned. What we hear, which largely comes from the public health department and the government and some of the media that sponsor them, is simply one more example, we've seen many since 2020, of the manipulation and weaponization of fear in order to control and manage a population.
Dr. Mark McDonald, who is an adult, child, and adolescent psychiatrist, saw firsthand during the coronavirus pandemic how the fear of an unknown virus, along with the implications of undergoing times of isolation, impacted his clients. The effect was so great, it led McDonald to write several books helping people to free themselves from the plaguing fear so many felt.
For a small percentage of the population, because they're already scared, and these are the ones that are walking around with their masks on, outdoors, with 3 or 4 sometimes, trying to hide from people and not shaking hands. Those people should be afraid, but not of the virus. They should be afraid of their mental illness, which is hypochondriasis, meaning their fear of germs. But everyone else should go about their business as usual. There's nothing to be afraid of. We're on the 16th or 18th variant of this coronavirus, which now should just be called the common cold.
While the views of the effectiveness of the vaccine vary, science has revealed it won't stop the spread.
I got infected about 2 weeks ago. It was my third infection, and I had been vaccinated and boosted a total of 6 times.
Even the CDC today, in their own data, has announced that those who receive the experimental mRNA injections are at greater risk of now getting sick with the 16th or 18th umpteenth variant, while those who did not, who got naturally infected and developed natural immunity, have a significantly less risk of becoming infected with any of the new variants.
Some health officials are sounding the alarm on bird flu as it's quietly spreading. According to the CDC, people in the U.S. have extremely low to no immunity to H5N1 bird flu. There are plans in the works to spend $5 million on vaccinations for farm workers. Do you see this as a scare tactic at all, or is it something to watch?
It's completely a scare tactic. This so-called bird flu or avian flu is just one more iteration of the annual flu. So given that the avian flu virus, this new dangerous threat, has not actually killed one single American to date, whereas the flu every year kills hundreds of thousands, the normal flu, so to speak, it really doesn't make any logical sense why we should be concerned.
The Washington Examiner spoke with Anna Burge, an epidemiologist specializing in raw milk production. According to Burge, the avian flu virus is spread through close contact and respiratory droplets, not food. So not to sound like a conspiracy theorist, but do you think hyping up bird flu is another way to attack the local raw dairy farms?
It wouldn't surprise me at all. There's been a concerted effort made by our federal agencies and government to shut down any type of independent farm. We all heard about what happened to the Amish farmers a couple years ago. Their dairy was sold out of milk and eggs because it was so clean and so fresh and so pure, and such a competitor to the large corporate mass dairy industry that the government came in and shut them down and said, you can't sell your raw milk, you can't sell your eggs, even though there was no reports of anyone actually getting sick from it. In fact, most people were probably healthier because of it. While
some remain concerned over bird flu and COVID, Dr. McDonald says staying ahead of getting sick by boosting your immune system through proper nutrition and regular exercise cannot be underestimated. I'm Natasha Sweet for Washington Examiner.